We've reached another milestone in the pandemic. There are now more than 50,000 cases of coronavirus across Southern California. More than 36,000 are in LA County, and in Riverside and Ventura counties together, roughly 3,900 people are listed as recovered. They are the only counties that release those numbers. And while LA County is still showing the most cases and deaths, health officials say we are making progress. And now some cities want to rev up reopening plans before the county gives them the green light. CBS 2's Dave Lopez takes a closer look at that issue.
Restrictions are easing and more people are enjoying the outdoors. And over the last 3 days in LA County, the number of new positive cases for this virus has surpassed 3,100. Should we be alarmed?
We don't really measure how effective we are at slowing the spread right now in terms of the number of positive cases.
And the reason? More people are being tested every day, close to 10,000 daily. And from the beginning, the doctor said, you hold the number to those testing positive at around 10%, and that's encouraging.
And that's all good for us. Finding people who are positive, getting them isolated and into care quickly, and figuring out who their contacts are is the most important thing we can do. So having a lot of testing will result in more cases, and we're prepared to manage that.
And what they have to continue to manage, the doctor emphasized, keep the hospitalization numbers down where they are. To date, just 16% of the people testing positive have required hospitalization. The surge that the experts feared has not happened.
We need to make sure that our average daily deaths have either decreased or remained stable for the last 14 days.
Over the last 3 days, the death toll has been 47, 51, and today 47. She was talking about the criteria that they'll be watching very closely to determine how much more of the economy they can open up, and to see if it's possible and safe to implement a suggestion brought up by Supervisor Catherine Barger. Have individual cities open faster than the overall county.
The 3 cities that have contacted me up in the Antelope Valley, their numbers have been low, and they want the opportunity to work with public health. I don't have a position at this point other than to ask both county council and public health to look at it and see if it can be done.
So it is on the table, and medical experts will take a close look at the possibility. Could it happen anytime soon? It all depends on the numbers. From downtown Los Angeles, Dave Lopez, CBS 2 News.